Hi, my name is Candace Brown, and today I'm going to talk to you a little bit about two health conditions. The first one is going to be dyslipidemia, and the second is going to be hypertension. So, to start off with, I'm going to talk to you first about dyslipidemia and some general information about it. You have to have abnormal blood lipids and lipoprotein concentrations, higher concentrations of LDL, cholesterol, or triglycerides, with a decrease in your good cholesterol, your HDL. It is a modifiable cause of cardiovascular disease, but severe forms are caused by genetic defects. There are certain treatments for dyslipidemia, like statins, and they can help lower cardiovascular disease. And in recent studies, it showed that those treatments helped lower cardiovascular disease by 30%. Increasing physical activity and reducing weight and having lifestyle modification changes helps in the treatment of dyslipidemia. And it also helps, exercise helps control cardiovascular disease risk factors. So that brings us to special considerations for exercise testing. Individuals should be screened for risk classifications before testing. Also use caution. They may have underlying cardiovascular disease. If they're cleared for testing, they can have the standard exercise testing methods and protocols for other healthy adults. You have to use caution for other chronic diseases. They might have obesity, hypertension, which we're going to talk about in a little bit, metabolic syndrome. So you need specific modifications to exercise testing protocols and different modalities. So that brings us now to the exercise prescription special considerations. They may need modification if they have other chronic diseases, if they take lipid lowering medications. It could cause muscle damage, or it could also cause muscle weakness or stiffness. So if they take anything like HMG, reductase inhibitors, statins, or fibric acid, they could experience some soreness. If they have some unusual soreness or weakness, then they probably need to see their physician about taking those medications. So now we're going to talk about the FIT principle for individuals with dyslipidemia. For frequency, they need to exercise aerobically for at least 5 days a week or more, mainly to help increase their caloric expenditure. For intensity, they need 40 to 75%, but no more than 75% of their heart rate reserve. For their time, they need 30 to 60 minutes of aerobic activity. The more time that they spend, the more caloric expenditure they will have. If they are used to exercise, they can exercise for 50 to 60 minutes a day. If they cannot withstand one continuous exercise bout, they can do small 10-minute increments to accumulate at least 30 minutes. The type of exercise they need to have is aerobic exercises that work with the large muscles. And this is all for resistance as well. Resistance and flexibility should be added to the prescription. And they can follow the same guidelines as healthy adults as long as they don't have dyslipidemia with comorbidities. So mainly weight maintenance is key to help control this major risk factor for cardiovascular disease. So that sums up dyslipidemia. Now I'm going to move on to hypertension. Some general information about hypertension. Individuals with hypertension have a resting systolic blood pressure of greater than or equal to 140 and or diastolic blood pressure of 90. So and if they're taking antihypertensive medications, or if they have been told twice by a doctor that they have high blood pressure, then they have hypertension. When someone is hypertensive, they have an increased risk of cardiovascular disease, increased risk of a stroke, heart failure, PAD, and CKD. Lifestyle changes like quitting smoking, modifying their alcohol consumption, losing weight, decreasing their sodium intake, and just having a healthy diet can help aid in the treatment of hypertension. So now we're going to move on to special considerations for exercise testing for individuals with hypertension. If they have uncontrolled hypertension, blood pressure, they should consult a doctor before starting any exercise program and testing. If they get permission from their doctor, they can begin light, moderate intensity of greater than 40% to less than 60% of their heart rate reserve, and they should do this in a walking modality. High-risk people need evaluation on their intensity and clinical status, so it depends on how severe their hypertension is. If they are at high risk, if they plan to do any moderate to vigorous aerobic activity, they should be medically supervised at all times during testing and exercise. Relative contradictions to testing is a resting systolic blood pressure of greater than or equal to 200 and or a diastolic blood pressure of greater than or equal to 110, and that was a relative contradiction. If test is non-diagnostic, they can take their medications, but if the testing is for diagnostic purposes, then blood pressure medications may need to be stopped with their physician's approval. Exercise testing should stop if their systolic blood pressure is greater than 250 and or diastolic blood pressure is greater than 115, and that's very close to the relative contradiction. So once they get to the 200 or 110 levels, you should be aware of the absolute contradictions of 250 and 115. So now we're going to move on to special considerations for exercise prescription. Training for people with uncontrolled severe hypertension should be evaluated by a physician first. Individuals with documented cardiovascular disease, training should start in a rehabilitation center, and that should be medically supervised as well. Relative contradictions is the same. Systolic blood pressure greater than 200 and or diastolic blood pressure of 110. And you want to try and keep that under systolic blood pressure of 220 and diastolic blood pressure of less than or equal to 105. Individuals that are taking beta blockers, diuretics, explain to them about the signs and symptoms of heat intolerance, hypoglycemia, and different precautions. So teach them about listening to their body and certain symptoms that they may be having they need to tell you about. Also with beta blockers, they need to use the rated perceived exertion scale to help monitor their intensity. To extend and monitor their cool down session afterwards, so it needs to be longer. Increase their caloric expenditure with a decrease in caloric intake, so that will help a lot. Older individuals may have a decreased blood pressure during exercise. Individuals with documented ischemia during exercise intensity should be less than the ischemic threshold, so less than or equal to 10 beats per minute. You also want to avoid the Valsalva maneuver during resistance training. So for the FIT principle, the frequency of aerobic training should be all days of the week, and resistance should be 2 to 3 days a week. Intensity should be moderate, 40 to 60% of heart rate reserve, or you could use the RPE of 11 to 13 on a scale of 6 to 20. And for resistance, it should be 60 to 80% of 1 RM. For time, they need to have at least 30 minutes to 60 minutes of continuous exercise, or again, they can do the 10-minute bouts of exercise to accumulate 30 to 60 minutes. For resistance, they should have one set of 8 to 12 repetitions for all major muscle groups. The type of exercise for aerobic should be walking, jogging, cycling, swimming, using those large muscles. For resistance, they can use the machine weights, free weights, and they should do 8 to 10 different exercises for resistance training. For the progression, this is important. They need to have very gradual progression, avoiding large increases in any of the FIT principles, frequency, intensity, time, or type, especially the intensity. So they need to have a very gradual increase in any of the FIT principles. So that sums up hypertension, and it also sums up dyslipidemia. Thank you for listening.